When it all first started, it was getting involved in cultural competency, becoming aware as not only as an individual, but as an organization with respect to cultural competency. And this was over 2 years ago, from even if I look at it from two lenses. So I look at it from our staff lens, and our staff having an appreciation of the need for a specialized navigator, facilitator, is huge. And it really allows our staff to recognize the importance of the program. Then clearly from the patient's lens is the feedback we've received is very positive, that they will access services that they were concerned to access before.
This work matters because the system that we work in and the healthcare system is really is not the way that we view health. And so it's not a holistic model, which is something that we're able to help and bring to the healthcare system, and in order for our people to heal, because we can't see health just as being one thing. That's why it's so important to be able to work within the facilities and with the different healthcare providers to help and liaise with them, to help explain that maybe we should look at this, maybe we should look at this point of view.
We can all be the greatest clinicians ever, and we can serve populations, and great, but you have to do it in a culturally sensitive fashion to ensure that there's a comfort level, that we respect their culture and we respect them and we respect what they've gone through, and to try to earn and gain their trust. And then the clinical outcomes, the positive clinical outcomes will come.
Any self-identifying Indigenous, Métis, Inuit person who comes to the hospital who just needs that support, whatever it is, from A to Z, I help them. They might not know the help they need, and I meet them where they're at. That could be transportation, that could be providing a book, providing education on their own health. So it's really everything in one.
I think it goes a lot deeper than just this role. I think it has to do a lot with understanding the history and the impact that that's had on our people, and that's why we come into a lot of the things that we come into, the challenges, the barriers, and to really provide that education for the healthcare providers is really important, so they have that foundation of understanding, why are we doing this? Why is this person here? Why do we need this? How is this different from what we're able to provide? And so I get that question a lot too, doing different service presentations in with different departments. They say, well, I don't really understand. So then I have to ask myself, then you don't understand a lot about the history. So if you understand the history and why we are here and what we're working towards, then that would be really good.
Healthcare is very complicated, even in the best of days. And by having someone who is assigned as a navigator for anyone's health journey is a very positive outcome, because they can help them get from one area to the next, and to move from one clinical program to the next clinical program, and try to remove some of the hurdles that unfortunately our system puts in.
To see people come from a place where they feel defeated, and then to see them at a place where they feel just empowered and important and getting the help that they need and deserve. I wish we didn't have to explain it. The importance of our first people that have been here since forever, to understand the importance of including them in everything that we do within the healthcare system. If we didn't have to explain that, that would be the ideal thing.
I'm very thankful to be part of SOAHAC in this position, because I know other navigators at other hospitals who don't have SOAHAC, And I really feel like I have an arsenal of supports. I'm exactly connected to my primary care team, my mental health team, the family social work. Like, I don't have to do all that. I connect and support, but the navigators without SOAHAC have to navigate that on their own. And I think it's very important that SOAHAC, I wouldn't be in this position confidently if it wasn't for SOAHAC.
So if another hospital is out there thinking of bringing on the Aboriginal Patient Navigator program, I would encourage them to do so. To talk to local partners, they are in the community, to talk to organizations like SOAHAC and engage with them and find out what the needs are. At the same time, talk to some of your patients you're already seeing and talking to them and asking what they would like to see. But when you put it all together, when you create this program, it's going to result in very positive returns, not only for the patient and the family, but also for your own staff. So I strongly encourage any organization that is interested in this to reach out. Reach out to me. Reach out to our team. We'll talk to you. We'll help you. Reach out to SOAHAC, and they'll help you make this a very positive outcome for your patients, families, and staff.